Good afternoon. This is Dr. Bill Wyatt again with the American Orthodontics Society, and I'm going to talk to you a little while this afternoon about bonded blocks and their regular use in regular problems you have in orthodontics. And we use them all the time. I mean, we will bond a block on somebody to whether we want to reduce the vertical height of the face or we want to open the bite, dentally and not increase this height. We use a bonded block. We use them so many times with have cross bites and you want to open the bite and then slide the teeth over, and that's one of the reasons we're using it in this particular case, but I'll show you about that. And we use bonded blocks all the time, and we know how to take them off and put them on, and I think I have a video of doing that. So let's get on with the show here. Here is this, let me get this young man up here, if I can. Okay, there's a fine young man here, and you look at it, you can see the midline is veered off to the right side of the face, and it needs to come back to the left just a little bit. You can see why in just a minute. We go in here, you can see it now. You can see this midline in the lower arch is pretty accurate, and the midline up above is way off because this lateral right here is back behind in a crossbite, and that let this cuspid come forward over here, and it's in the space where the lateral's going to have to be. So this case was pretty simple. We were just going to move this back and move this over and open this up big enough to get that lateral through that gap and pull that in place and everything, and it worked out great. But we needed some space in here when we want to bring that lateral across. So we're going to bond a block on these teeth right back here. We just may take the lab acrylic and put it in a little petri dish and put some liquid on it and kind of get it involved in the whole thing. The liquid covers all of it, and then you roll it around and mess with it till you can take it and work it in your hands, and we just pull it out in about the shape of a pencil, something like that. We'll show you putting it on in a minute. This one doesn't give you a real complete deal of it, but anyway, we'll show you that. All right, here is the guy's smile, and that's once you get the teeth in there, everything lined up all right. The gumminess of the smile won't bother you at all. There. Now this cuspid is coming in from up high, and it's out to the labial, and this bicuspid right here, and here is a permanent lateral, and here is another bicuspid back in that area. And I think that's the teeth that are in there, and the midline is way back over here, on the bottom, and here is the midline of the case actually. So let's go down to the next slide, and you'll see virtually the same thing. And we've got a cuspid coming in up here. You're going to have to, that baby tooth's going to have to go and increase that. And take it back over here. This is a baby tooth right here, and it'll have to go. And these two bias will fit in here, and this cuspid will come back, and we're going to open this gap right in here and slide this midline over in this direction, and we'll make room, and when we get room in there, we'll have a space. We can bring that tooth through that gap right there. Okay, on the bottom arch, we're doing great. I mean, it's working out fine. We do have to line it up a little better in the areas like that. But the 6-year molar, the second molar, looking great, no problem there. So we've banded it, bracketed the everything except we band the molars and leave them in bands, and we've got a spring on this opening this gap, and we've already got it open about like that. And when we get it fully open, we'll slide that tooth into that space and turn it around and correct it. You can all do this. This is just a way we've developed over a period of years, and I'm using these little single brackets. It gives me a real big bracket space in here. I can put torque and tip and in and out and everything you want in that area. Well, I'm going to have to get this out on the deal when we finish it up. All right, on the other side of the mouth now, when we put the block in, it leaves you a gap. And you can see the block. This is the block right here going back. We just made a little pencil shape and put it on the teeth. We etched these teeth and dried them. Put this liquid in there that bonds this more solid material to the tooth, not strongly. When we get ready to take it out, we just take a barrel burr and go right down in the middle of this thing and then squeeze it from side to side and pop it off, and you can get them off easy. They don't stick on there real hard. All right, we've made space enough there, and we're going to pull that lateral through that gap and then rotate it, and then rotate the centrals back where they should be. And we take this and grind it down until you just have the little points touching in there. Now your jaw slide back and forth on there very good. And you just leave it like that while you open it up. Now the other side will close together while we get this going. All right, there it is again. Now there's the block is in place, and these teeth are coming in contact here in just a few months. A couple of months they'll be down in place. When you take this off, you're going to have a gap over here, and then it'll come in, and then the whole thing will level out without you having to do anything much to it. Just keep it lined up. So here we go again. We're pulling that lateral through that gap, and that's the bonding block again. Now we have removed the bonded block over here, and the teeth are touching on this side, and these are not. But you just leave this very quickly, a couple of months, these teeth will be down in place right over here. Excuse me. All right, here the bottom is finished out now, and here it is before we started. These are bicuspids of digits 2. Here's the permanent lateral of the cuspid right there. Now here's the way we pull that in and go to 94 there. There the midline is way the heck off. Here it is on the bottom, and here it is on the top. And now you see the midline is right over dead center almost. And these teeth are back in, that's to start with, and there they are after we just about finished the case up. There it is, the top arch, and how it kind of tilts and goes in that direction. And now we're going to look at the permanent, and you see the whole center line of that thing lined up like that and lined out. Now you can do this. I mean, if you're a dentist and are trying to learn orthodontics, you'll have to study these videos or go take a bunch of courses and work it with them. Now, if somebody leads you off to the wrong trail, come back to these videos. We've done this stuff for 40-something years, and I'm only showing you things that work, and that's where I promise you can do this work with this. And if you question any of this, we have a room here in Glen Rose with all the records and models and everything. You can come back and go over them if you want to. It's fine with me. All right. There's the lower when we finish up. There it is, finished. I'm sorry. Inner retention, and this is 1994. Now this young man didn't wear this retainer good enough for me, so I've got a problem here where he did not wear it properly, but we got him to straighten up and do it, and so here he is. I'm sorry, I've got a dog outside that's barking. This is 95. And there's that lateral tooth that slips over that place. Looks like it's backed up slightly. 97. And if he'll take care of this a little bit, that young man can have these teeth in that shape when he's an old man. I think this is a weird picture. It's not set up right. Thank you for watching, and I hope you'll join our group and subscribe to the program. We're glad to have you. And this is how we widen that. You see, this is 1, 2, 3, bend back this way. We're starting to over there. And this is 4 and 1.5 millimeters right there. And we went out till we got him down to 49 millimeters. In other words, that's where it was over here, and that's down to 49. So we widen that upper arch out that much. And here is the young man, and thank you for watching, and I'll close out here, and hope you'll subscribe to our country. That's there in class. I'll close this.